Hi, Dr. Kang's scuba diving stories for today is hazardous marine life, the fourth story, and it's about textile cone snails. Like many other things, beautiful things have poisons, and this particularly cone snails, very pretty. Look at the design this one has, and still these are very poisonous. They have poisons right out here. And I will talk about the cone snail itself and the toxin or venom they have, symptoms, prevention, and first aid as well as treatment at the hospital. Textile cone snail. This is one of world's most toxic creature. We should never misunderstand them because of their beautiful shells. Whatever is inside, it's very toxic and very dangerous. They are armed with small harpoons formed from modified teeth. So they they come out of this. They shoot their prey and they catch them. And look at this harpoon here. Looks very much like the tip of fish anglers, harpoons, and this is the real thing. And once stung or bitten, you cannot really remove it yourself because this has very interesting angle, just like the harpoons we use. They have hollow harpoons and penetrate skin and wetsuit in even gloves. So wetsuit and gloves cannot really protect you. You need to prevent yourself. And this is a closer look. And the toxin or venom they are very toxic. They are painful, but pain is nothing to whatever neurotoxin they have, which causes specific muscle paralysis. They say one drop can kill 20 adult men. That's very toxic. When first stung, we may just feel pain at the beginning, and for several days, maybe we can go without any severe symptom, but they can come after several days. What kind of symptoms? In severe case, you have a numbness on the entire limbs and mouth, and then it goes to the entire body. Think about the paralysis of diaphragm and intercostal muscles. You cannot breathe. So first time you're stung, you feel pain, but you still have to go to hospital because this respiratory muscle paralysis can come after several days. This makes this animal really dangerous. Sting happens almost always on hands and fingertips. You try to catch it and they try to sting you. When mild, it resembles the symptoms of bee or at worst wasp sting. Yes, they are very painful, but numbness and tingling will start to come out, may advance to cyanosis, numbness to the entire body, and then it can go to anything of these: syncope, itching, loss of coordination, and heart failure. This is very serious. Difficulty speaking, difficulty breathing, And you can even see two things: double vision, diplopia. Like I have explained already, at the beginning you may just feel pain, but sometimes very rapid paralysis of respiratory muscles can come, which means you can be in a serious problem if you're not in the hospital. And very luckily, so far we have no reported case of cone snail sting death. It's mostly because you are smart enough to go to hospital immediately and wait sometimes, or even if you go home, this respiratory muscle paralysis comes slowly and steadily, so you feel very difficult breathing for some time. So you are brought to the hospital, and the hospital will take care of you. So it's very important that you stay alert. You can't just go home and stay very away from the hospital. Prevention, the only prevention and the most important prevention is don't ever try to catch them. You're not supposed to catch or collect anything from underwater, particularly these cone snails. You don't collect them, you don't catch them. That's the only prevention we have. Very pretty, this one too. I don't think we can ever make a design like this. It's very, very pretty. But this pretty animal will hunt like this. It shoots a fish, and the fish is paralyzed, cannot run away. And then slowly the snail eat fish. The first aid, most important for the divers. If you find yourself or your buddy or anybody stung underwater by this testile cone snail, you have to help him or yourself to surface immediately and exit the water. You call emergency medical service, and you have to go to hospital immediately. Stay in hospital and wait and see if further symptoms come out, which is at the worst heart failure or respiratory failure because of the muscle paralysis. There is no antivenom available at this moment, but while you move your body to the hospital, you can pressure immobilize, but still you have to release the elastic bandage for 1.5 minutes for every 10 minutes. So you keep it on for 10 minutes and then you release it for 1.5 minutes, which is 90 seconds. And you repeat that 4 to 6 hours on your way to the hospital. This is the first aid we can do. Let me repeat. We remove the patient or remove the victim out of water immediately. Call 911 or EMS on your area and go to the hospital. Even if there is no antivenom, we can still keep a very close eye on the patient and see if any further symptoms come out. And use electric bandage for pressure immobilization for 4 to 6 hours. Put it on for 10 minutes and then release it every 1.5 minutes. This is what a diver can do for first aid. When you go to the hospital, we have many different medications to help. Either the paralysis or complication of the toxin, or the sequelae, including hypotension. Then we give some Naloxon for that. But if the sting is still inside the skin, do we remove that? it is best if a very well experienced surgeon remove it without giving further injury. So no lay person, not just anybody, can incise the wound and try to take this thing out. No, let it be handled by a professional. About a very old time's sake, we used to incise where we are stung, and then we suck the toxin out. You are putting a lot of saliva on the wound, and it can give you the secondary infection. No, it's not a good idea. And do not put any tourniquet on the wound. We only do the pressure immobilization above the wound, closer to the heart. So this is about what we do for corn snail sting. Okay, talked about corn snail and their toxin. And let me stress or emphasize the first aid for scuba diver. Remove the diver out of water, call emergency medical service, and transport him directly to the hospital, and wait and see if there is any pressure bandage available. You can put the bandage on top, no, above the wound, closer to the heart. Most time it's the fingertip, so you can put the pressure here and try to slow down the toxin going toward the heart. But that's about what it can do. And it was the fourth story of hazardous marine life, and it was about textile corn snail. And thank you very much for your attention, and I'll be back with further stories.